because there's no growth without discomfort. So I'm like, I'm growing all the time too.
Yeah, no. And I think you made a good point too, when you said, that people, they get comfortable, they get complacent, and they go to the book and all. That's why I always say, like, we need to change this about therapy. Like, yes, the book is helpful. It is a guide. We need to know, like, certain, if they're having certain, symptoms, the symptomology part, but we also have to remember the biology part. We have to remember, like, look into, like, all right, are all your hormones in check? Did you get all this checked out? Because people immediately want to go, like, okay, I'm have depression and anxiety and all this, like, I need medication right away. And it's like, okay, well, let's look at the background. Where is that coming from? Let's look at and so I think that's one thing that people have been so afraid of going to therapy, is because, first of all, they think, all right, I must be crazy. They're going to try to give me medication, and that's not what I want. And so it's like, okay, good. I'm glad that's not what you want. Let's talk about that part first. And, the medication, all that can come later. And
if it even needs to.
Right, it even needs to. Yeah, exactly.
I've been in certain sessions where, depending on who it is, where most of those things have come up. And we always, of course, rule out medical first. So I'll ask, have you been to your primary care provider? Have you been to, have you had blood work? Get all that. And actually, I had a client who was experiencing some of those things. And that's what I shared with them. Like, hey, go to your primary care doctor, get some blood work, get a complete blood count, do the cholesterol, all that good stuff. And, it was discovered then that there were some, just some small minor things that it can change. And it actually helped with the depression, because I didn't know what was wrong. So sometimes you're right, like, check out the medical part, because it's not
so many misdiagnoses that I've seen. And, like, working in inpatient as you did as well, like, everyone is slaps on like 3 different diagnoses on you. It's like, oh my God. And then this person comes out and that becomes their identity.
Absolutely.
And that's what bothers me too. It's like, just because you have depression, just because you let's say you weren't correctly diagnosed with bipolar disorder, that does not mean that's who you are.
Right.
That means it's something that you have to work through. It's some kind of chemistry that has to get figured out. And there's other things you can do. But, like, that becomes their identity. So you have one mental health breakdown in life. And I don't know if you two have ever been there, but I've been there, to where I had a bottle of pills in my hand for my anxiety pills during my divorce. And I looked at it and thought about it for about 30 seconds of taking that whole bottle, because I was in such a deep depression. And I threw that bottle across the room because I was like, you have 2 kids, 2 little tiny kids. I was like, I could never do that. But in that moment, what, now I'm crazy?
Right.
No, I was having a deep moment. I'm going through an environmental change to me. That doesn't mean that I need to be on like 10 different meds.
Right.
And so we need to educate people about that. And I think that's what we need to change a lot of, because there's so many people that just go by the book.
Right.
You have this, we were going to diagnose you with 4 different things. And that bothers me personally.
Right.
And it really does, because that's not what therapy should be all about.
And that's what I think is so great about Bella. Because we get down to the nitty gritty with our clients, and we look at it from different aspects, not just one dimension, but we look at it like 3-dimensional. And so, that's what makes us a good team, because we're not just, oh, okay, well, you have anxiety. Oh, okay, well, you have bipolar. Oh, okay, this. We try to rule out different things before we actually, make a diagnosis or, just, do a treatment plan for our clients. So I think that's very important too, because, our clients, they want to be heard. They want to know they're important. They don't want to think that they're crazy. And we don't treat our clients like, they're just a number or a name that we check off next and go to the next person. So I think that's what makes us very unique as a team.
Well, it's funny, put this on the board again today, hearing all this, and it's really because, again, it has come top down. Attitude reflects leadership. We literally practice what we preach. We really do. We do, even in business, whatever. But I'm always, like I said, I'm education. So to me, every time I'm doing something, it still comes down. And one of my favorite sayings is, love finds solutions and difference makes excuses. And today we were working on stuff, what's the opposite of love? They're like, hate. I'm like, yeah, good try. No. But try again. But we talk a lot with, our logic brain and our limbic brain. And that's where so many people, get confused, because again, if we go biopsychosocial, you're welcome, college kids, because it is 3-part, and that's the thing. Yes, there is a biology to it. Absolutely.